Hello friends, have you heard of this condition sickle cell syndromes? Do you know of anyone having this condition? So what exactly it means? Why it happens? What happens in this condition and what could be done? You want to know about this? Great, exactly, that's the reason why I made this video. Keep watching my channel for your information, FYI. So sickle cell disease is one of those conditions which collectively are called as hemoglobinopathies. So there is some abnormality in the hemoglobin of these people so that they end up having this particular condition. So before discussing what sickle cell disease is, we must understand what a normal hemoglobin is and what abnormality happens in sickle cell condition. A normal hemoglobin has four protein chains, they're called polypeptide chains. In each chain, there is a heme moiety, which is the iron moiety. So you'll understand that there are four chains, two alpha chains and two beta chains. Each chain has a heme moiety in it, which binds with oxygen. Each chain binds with one molecule of oxygen. So a molecule of hemoglobin can bind with four molecules of oxygen at a time, maximum. So what happens is, the way this entire polypeptide thing has been designed is at high oxygen pressure, which is usually in the lungs, which has air flowing into it. At high oxygen pressure, this hemoglobin keeps binding to oxygen. So one molecule of oxygen binds to one of the chain, immediately its affinity increases. So more and more oxygen molecules instantly they bind. Once this happens, it flows. So this hemoglobin is in the RBC cell, which flows in the blood. So it is in that RBC, it flows and delivers to an organ which has been working over time. So this organ keeps working. So most of oxygen is utilized. It is an acidic environment with low oxygen pressure. It's exactly what the hemoglobin senses, and it releases the oxygen molecules there. So our basic school sciences, it teaches that arteries carry oxygenated blood. Arteries break down to arterioles, which break down further to capillaries, which are very thin, allow for exchange of gases. And again, capillaries that build up into venules, which build up to veins, which return the blood back to the heart. So what happens is, these RBCs, which carry the hemoglobin, have to be very flexible. They need to be able to maneuver their way all the way through the high pressure conditions of the arteries, through the capillaries, and again go back to the veins and venules. So if they become stiff, they're not able to get through this entire thing. They clog this passage. Now in sickle cell disease, what exactly happens is, if you remember, I told you hemoglobin has four polypeptide chains, four protein chains, right? Two alpha chains and two beta chains. So these polypeptide chains, they are made of amino acids which are on different particular positions, like 1, 2, 3, 4, 5, 6, that position. So in sickle cell disease, there is a genetic mutation, as a result of which in the beta chain, in the two beta chains at the sixth positions, one of the amino acids gets changed. Now we have hemoglobin in a, suppose I have sickle cell disease, my hemoglobin, the beta position, the sixth position in the beta chain is changed. This type of a hemoglobin, once it reaches an atmosphere which is deoxygenated. Now suppose from the lungs I'm getting, the hemoglobin is oxygenated. There is oxygen in the hemoglobin now. It has flown to an organ, let us say my bones, which have already used some of the oxygen. So my muscles which have already used oxygen, now it's a deoxygenated environment. In that environment, this kind of mutated hemoglobin, it polymerizes. Once it polymerizes, it increases the viscosity. It makes the RBCs rigid. The RBCs also dry up because potassium flows out of them, calcium enters into them. So they become rigid, they become dried, they acquire a sickle kind of a shape. That is exactly what you say, sickle cell condition. The RBCs no more manage to maneuver their way through these capillaries. They clog the veins, which increases pain at the organ level. Whichever organ is utilizing this, they feel this pain of not having adequate oxygen. They get blocked. This type of a blocking not just causes pain. Once there is this persisting situation, they start dying. So you get an asphyxiated condition, an unoxygenated condition in that organ, which again the tissue in which starts dying due to lack of oxygen. What also happens is that these RBC membranes, they are sticky in sickle cell condition. So once they become sticky, especially in the young RBCs, which we call as reticulocytes, these sticky membranes, once they're flowing through the venules, they stick to the walls of the venules. So there also the causes occlusion. Now the good old friend in our body, spleen, it identifies these RBCs. Spleen is said to be the graveyard of RBCs. So old RBCs, they go to the spleen and die over there. Spleen identifies that these are corrupted RBCs and should be destroyed. So once spleen identifies this, it starts destroying. So there is a condition where you lose the RBCs due to increased destruction in the spleen, hemolytic anemia. So you would logically agree that whichever organ have very narrow pathways that the RBCs needs to negotiate are the ones that would be repeatedly exposed to this crisis of occlusion. Spleen is one such organ. It keeps fighting, it keeps killing those RBCs, but at the same time, it also undergoes micro-occlusion multiple times. Usually in people who have a homozygous condition, like a more severe condition of sickle cell disease, in which both the genes that they have inherited from father, mother, both genes have this mutation, their hemoglobin is more sickled, they lose their spleen around 1.5 years to 3 years into life. The spleen is knocked off, called sequestration. In others, not in others, the other possible things that could happen in such severe homozygous sickle cell diseased people is that they could experience repeated episodes of pain. I suppose they're what could actually initiate pain? When they exercise a lot, they need more oxygen. In such conditions, they could face occlusion, or they get into an environment that is extremely cold, which constricts the vessels further, or infections also, some infections. One of the problems that could happen with the spleen being knocked off is that spleen also kills off some bacteria, especially pneumococci, which causes pneumonia. So these people, once spleen goes off, are more susceptible to pneumonia, chest symptoms, fever, anxiety due to pain. So those are common situations, but those happen only if you have inherited your genes both from the father as well as mother. So you are a homozygous sickle cell disease. But suppose one has inherited a sickle cell gene from one of the parents, while the other parent has the gene from the other parent is normal. In that condition, they have the sickle cell trait. So in them, this kind of vaso-occlusion, occlusive crisis is extremely rare. But even they could also, and they're usually asymptomatic, but they could also experience rare such situations if they undertake massive exercise, or they climb up to higher altitude, or they're exposed to extreme cold, extremes of cold. In such situations, they might experience this kind of vaso-occlusive crisis situations. So you naturally ask that if someone has sickle cell trait or sickle cell anemia, the homozygous condition, what actually predicts an adverse outcome? So it's difficult to say, it varies from person to person, but if you're having repeated episodes, or you're getting repeatedly hospitalized, or you had a hand-foot syndrome or an acute chest syndrome, or similar kind of crisis conditions, you're having them repeatedly, your spleen is already sequestered, it's gone, then outcomes are relatively bad as compared to normal people. So that's the situation. So how does one actually diagnose sickle cell disease or sickle cell trait? The main approach to it is you start suspecting of sickle cell diseases. So you have more of vaso-occlusive crisis, you have anemia, and you are basically staying in an area. Usually people come from an area that is endemic for this condition. The classic investigations that one would ask for is to go for a blood picture examination, a blood examination under the microscope, which will give you pictures of hemolytic anemia, broken cells, different shapes, and especially the sickle-shaped RBCs, which you'll get to see. The other thing is doing a hemoglobin electrophoresis, which gives you a fair idea whether you have sickle cell, this kind of modified hemoglobin. Uh, People do genotyping at times, and that's exactly where your picture of genetic counseling comes in. When you potential spouses, they can go for potential couples, they can see whether they are having this particular kind of gene. uh, yes, once diagnosed and once someone has sickle cell disease, especially, the line of management is basically managing the complications. So, if someone is having this vaso-occlusive crisis kind of condition, you hydrate that person very vigorously. You hydrate. Oxygen therapy also helps, and infections. If you have infections, then antibiotics. Those things help. Splenectomy, yes, it helps, especially in children. Some people also go for bone marrow transplantation. That also helps. As regards medicines, one hydroxyurea really helps. See, the sickle cell mutation that happens affects hemoglobin A, which is the predominant hemoglobin in the human body. But hydroxyurea, it pumps up the fetal hemoglobin, which is good, and it helps such patients. There's some neoplastic drugs also tried, but they never actually looked very brilliant in the management. Management of pain also forms an important aspect of the overall management of these patients. So, at times, people require morphine or opioid analgesics. Uh, Gene therapy, yes, that is being evaluated. Not quite available in low and middle income countries. So that's it. That's all. Don't panic. Not a majority are sickle cell traits. This being an recessive, autosomal recessive condition. If both the genes are not homozygously paired, like both the parents are giving this gene to the progeny at the same time, they don't manifest as sickle cell disease, they manifest as sickle cell trait, in which these kind of symptoms are really rare. These patients pass off mostly asymptomatically. So guys, that's about sickle cell disease. I could simplify it, but I kept it somewhere not oversimplifying it. If you like my channel, please hit the like button and subscribe. You'll get. I'll try and make up more and more informative videos, especially on medical disorders that are fairly common in certain subpopulations. Thank you for watching my channel. This is for your information.